We've already learned that we're very compatible. We have a great cultural compatibility, these two systems.
We did a culture survey, and we chose about 450 colleagues to answer the survey. And the consultants shared with us they have never seen such cultural alignment between two organizations. So we asked ourselves why. Why would we see that in our associates and our colleagues that are all in different states across the United States, very different venues? Why are we so aligned? And I like to say it's because the mission of what we do is in our DNA, and that the sisters, the sponsors, can go forth and know that their founding charisms are embedded in the associates and the colleagues that serve our ministries and will be partners with us as we go forward.
I go back to the 70s when the community that I'm a part of, the Sisters of Mercy in Detroit, had 22 hospitals, and we were losing them one by one. And we decided, we being about 4 sisters who had a vision, to create a system. And watching what people who brought that system together, first by moral suasion, because they were pretty independent, what they could do to support quality of care, finances, personal development of the people who worked in the system. I think most of our local communities never realized that they were part of something larger, but the service was better because of the expertise that we had now, the integration and the synergy. And so I look forward. CHE has many strengths that Trinity Health could use, and Trinity Health has strengths that CHE uses. So I think it's what needs to be done in this day and age, particularly with how healthcare is going in this country.
Healthcare is in an interesting time right now, so the questions are, where do we think we're going to be in 5 years, and how can we use our strengths that we both have individually now and bring them together? How is technology going to fit into the future? How are the resources that we do have? We have limited resources. How do we use those in the best way in order to serve the people most in need?
What I was looking for out of this was enough indications that we could take scale, which is breadth, and turn it into something that has depth. Because most healthcare is local, and the strength of the coming together is in the depth you can create in the market where you happen to find yourself.
And I think by coming together, we're creating such a large pool of knowledge, large pool of experience for our individual ministries to be able to tap into as they seek to improve the quality of care, as they seek to improve the patient experience, as they seek to better manage their expenses. I think it brings new meaning to the phrase, together we are so much more.
We will have a very strong presence in senior services. We'll be providing excellent long-term care services, hospice, and home care. I think we'll be one of the largest in the country, actually, but certainly among the Catholic healthcare providers.
Well, I had been in the role of a colleague, so I know what I would be looking for. I think they would want to hear that we're going to engage them at every level, and I think the work we've done so far has communicated that we want their engagement, because change will happen at their level. And I think I want them to hear the challenge that we're placing on their shoulders too, which is that we're in the midst of transforming the healthcare delivery system. They have to make it happen. At the same time, they have to be true to that fundamental commitment of justice for all, respect for the person-centered care, quality care at low cost. And that's the message I think they need to hear, and hopefully they'll be equally excited about it and will want to join in this huge effort, which I think can have wonderful ramifications, not only for our Catholic healthcare ministry, but for the transformation of health delivery in the United States.